We're always hearing about the benefits of aspirin for your heart health, but should we all be taking it? Dr. Laurence Sperling joins us now to break down the guidelines and sort out the confusion over what a doctor-directed aspirin can do for you and who should be taking one according to the CDC. So thanks for joining us, doctor. First, how is aspirin used for cardiovascular event prevention?
This is a very important question, and what we want to focus on is appropriate aspirin use for heart disease prevention. This is where we think about the population at highest risk. These are individuals that have had a prior heart attack, a stroke, a bypass surgery, or a stent. And in this population, aspirin use is very effective in reducing the chance of a second heart attack or stroke or cardiac event.
Okay, well then if someone has had a heart attack or ischemic stroke, what is their risk of having another? And how does aspirin help reduce the risk of a second one?
In somebody that's had a prior heart attack or stroke, over the next 5 years, the chances of having a second heart attack would be about 1 in 5, and the chance of another clot-based or ischemic stroke would be 1 in 4. Aspirin affects the platelets. These are cells in our bloodstream that can cause clotting, and so aspirin's basic mechanism is to reduce the stickiness of these cells and reduce the chances of a blood clot in our blood vessels.
Well then, it seems like aspirin is safe from what I've heard over the years, so can you just make sure that we are understanding that correctly, and what advice do you have for people who are currently taking aspirin?
The most important advice is speak with your doctor or your clinical team about whether aspirin is appropriate for you. For every medication, whether it's aspirin or any other medication that individuals take, we always want to focus on the potential benefits, but also recognize the possible risks and side effects. So have that ongoing conversation. Ask these questions with your clinical team.
Okay, well, if we want to learn a little bit more and see if this is the right fit for us, other than talking to our doctor, of course, where can we go for more information?
Yeah, thanks. I'm a practicing cardiologist, but I also serve as the executive director of the Million Hearts Initiative. This is a national initiative focused on the possibility that we can prevent 1 million heart attacks, strokes, and cardiac events in our nation over the next 5 years. And so learn more about Million Hearts, but also learn more about appropriate aspirin use at millionhearts.hhs.gov.
All right, really important stuff there. Thank you so much, doctor. And if you'd like to see this segment again or get more information, you know you can head to our website as well.